Muito obrigada aos dois por este arranque oficial. Avançamos com os trabalhos com a doutora Gloria Carrasco, da IS Global, para nos falar de saúde urbana e liderança local como promotor de cidades mais saudáveis. Bem-vinda.
Obrigada. Antes de mais nada, peço desculpas, não falo portugués. Voy a hacer la sesión en English, so I will switch to English now. Yeah. That one in the middle? That one? Yes, this one. Okay. Yeah. This is cities. Nowadays, some cities are this huge. So 55% of the population worldwide live in cities. This is a 2008 data. In the future, it will be up to 70% of the people worldwide will live in cities. Especially, there's going to be a big increase, especially in Asia and Africa. So this has a big impact on the resources of the cities, also in other factors, such as this. No. Maybe this one? No, this is the first one. Esta es la primera. Yeah, it should work. Yeah, okay. Well, I'll try. Air pollution is a big challenge for cities, and also noise, lack of space in cities, opportunity to walk and cycle to do physical activity while we are in the city. And as I was saying, by 2050, 70% of the world population is going to live in cities. This is also a big opportunity for cities to become more sustainable and also efficient, but we need to work on this. What is health? Well, as you know, health is a state of complete, this is a definition by the WHO, is a state of complete physical, mental, and social well-being, and not just the absence of disease. So we need to make sure everybody is in good health, despite not having anything. But just health is not just drugs, taking medicines, getting treatment, or going to the hospital to cure illnesses. Health is what we do, where we are, and the places that we live. Health is where all of this. Okay, just to give you a brief examples. Life expectancy depends on the places that we live. For example, this was a study done in 2016 in Glasgow. Males, well, actually, this data is from 2016. Males in the high socioeconomical status in the neighborhoods in Glasgow lived 15 years more than males in other neighborhoods more deprived. And women, there's like an 11 years gap, but there's something going on in the neighborhoods. They are. I'm sorry. Yeah, and in Barcelona, for example, I couldn't find a map for Porto. Maybe there is one, but I couldn't find the data for different neighborhoods. What I found is that in Porto City, the life expectancy is 81. And in the upper north of in the metropolitan area, it's almost 82. So we should see this data by neighborhoods because it's really important. But these differences in Barcelona, the difference is not so big than in Glasgow. But is this difference in life expectancy just due to socio-economical factors only? This is a very, this graph is very well known because it puts people in the center with our age and our sex and our genetics. And this, of course, determines our health, but also what we do, our lifestyle factors and where we work, our healthcare services, housing, education, loads of factors determine our health. But outside the outside layer is showing that general socio-economical, cultural, and environmental conditions can greatly impact our health. The WHO said that 23% of the global mortality is linked to environmental factors. But there's also the cultural and environmental factors. And pointed. Okay, obrigada. But in fact, 80% of the health is determined by how we live, so our choices, what we choose as a lifestyles, different lifestyles, social, economic, and environmental factors. So our zip code, where we live, is a better predictor of health than actually genes, right? So there's something we can do about this. The non-communicable diseases, those diseases that are not transmittable, worldwide, as you can see here, there is a big mortality related to these diseases. In the next year, so up to 2030, they are going to increase a lot in the developing regions, but in Europe already, it's 85% of the deaths are related to these non-communicable diseases. We could see in the other bit like cardiovascular diseases, obesity, high blood pressure. So all these diseases that we can change if we change our surroundings and what we do and the environment. So how do we do that? Here, my colleagues at IS Global in Barcelona developed a framework to link urban design, transport planning, environmental exposures, and human health. For example, here, if we have a dense city with a lot of traffic, vehicles, it's going to be a lot of air pollution, noise, the heat island effect as well, and then less opportunities to do physical activity, less public space to have green areas, and all of this is going to have a huge impact on the health of the people that live in these cities. So just to have an example, Barcelona has a 60%, now it's a bit better because there's been loads of different policies giving back public space to the citizens, but this 60% of the surface are dedicated to vehicles, which actually excludes people from walking, parks, children, old people just enjoying the street, and it's always a big hazard to be on the street because you have to pay really attention on the cars, and it's dangerous, of course. So mobility has health effects, of course, some negatives, which are the air pollution, heat, as I was saying, and noise, but also may have mobility, some positive effects, of course. And this is the physical activity. When we commute, there's this term called active physical activity. When we go to work, when we go to study, when we move to places, if we walk or cycle or we do anything that involves physical activity, we can actually integrate the physical activity in our everyday tasks. So that makes easier to incorporate them in our life. And also if we do it through green spaces or blue spaces, that has even a major benefit for us. But the drivers of health do not come from the health system, the health sector, come from the outside as well, and they have a major role here. So a few years ago, we created a database that is online with open data for 1,000 cities in Europe. And with this data, we saw that loads of deaths were avoidable if the air pollution levels met the criteria set by the World Health Organization. So basically 84% of the population in European cities is exposed to levels of particles, PM2.5, above the maximum recommended. So that's a huge impact on the health of the population there. I just gathered some data from Porto. This was, I think it was 2019, this data. This data is gonna be automatically updated. But basically, the WHO for particles on the left, it's 5. You may not see it because it's very small. And it was then 14. This is a mean, annual mean for Porto. And this is Porto metropolitan area because there was no data for the city. It was 14. The WHO recommends 5. And for gases like NO2, it was 28. And the WHO recommends 10. And then just briefly, on the top, on the left top and the right top, you get your position within the cities, within all the cities. So it's not too bad. And below, the first number is the number of deaths that could be avoided per year if these recommendations of the WHO were met. And then all this data from 1,000 cities was again collected, and data was separated by cities depending on the size of the city. So Porto would be here, because I think it's just 250,000, right, more or less. And it was compared to other 177 cities and 76 cities in Europe. And then what we did is there was we did an index to compare these cities and to know how cities are scored between them. And there was this Healthy Urban Design Index that assesses 13 indicators for each city. And just to give an idea on how the city is doing regarding these 13 indicators that have something to do with health. And basically what we explore was for example, on the left, it's the same, but it's just the way it comes out. On the left, very good for Porto, mid-rise development. So basically buildings are 5-6 high, which is good for cities because the higher you get buildings, the more pollution, and then there's less space for ventilation and temperature in the summer. It gets really no ventilation at night. And then it's a city that it's not compact. But then if you see the red in the middle, it's like opportunity to cycle. I guess in Porto, there's no many bike lanes, no? and also the permeability. It's important to have permeable streets, so when it rains, the water goes in and there's not much runoff of the water. And then air quality could improve, and the greenness as well. So with these 13 indexes, you are in the 7th position, so it's not bad. And the score is 6. I guess no, there's not the perfect cities. And just very briefly, this is the map of the city with the different 4 domains, and just showing the areas that the city should work more on. The darker, the better. So the performance is better. For example, for the green spaces on the left, it's better in the dark areas. You get more green spaces. And this is just to mention these indexes are not perfect because my colleagues that work on this are collaborating with cities to improve these outcomes. But it just gives an idea to the city in where the cities are. And at IS Global, we created an interactive report that takes into consideration five points for healthier cities: air pollution, noise, physical activity, natural spaces, and temperature. I'm going to focus on just air pollution and natural spaces because I don't have time. And air pollution is the fourth principal risk factor for premature mortality worldwide. And just above, is high blood pressure, tobacco, and dietary risks. So it affects a lot of people, so it causes a lot of that air pollution. Just worldwide, you can see that particles, PM2.5, which is it's quite a small particle, but it's not the smallest, but it causes a lot of death. You can see the countries like India and China, they have a huge number of deaths related to air pollution, particles. They still cook there with carbon and coal, yeah, thank you. So effects of the air pollution in general, you probably know, you've seen this before. All-cause mortality for adults, cardiovascular disease, lung cancer, asthma onset in children as well. So children exposed to air pollution start the asthma attacks. And then even for pregnant women, we did a study with pregnant women. It was a cohort study. We are following them. It's 1,000 pregnant women. Well, they were pregnant like 6 years ago. And just to see babies are born with lower birth weights, and they are small for gestational age. And then this is just a study that came out. I saw it yesterday, actually, so I put it in here. Air pollution during pregnancy is associated with slower brain maturation in newborns. They did MRIs to 1-month babies, and they found that there were low levels of myelination in the brains, and myelination is a marker of brain development. So if they follow these babies, maybe they will see that this is a good predictor for later on brain not growing properly and not functioning properly. Health effects, another study that we did that was about 15 years ago, the breathe study with from 7 to 11 years old children. We saw that children in schools, we compared children in low polluted and high polluted schools, and in the high polluted schools, their working memory was improving because their age, they improved the working memory, it's natural, but it was improving less. This was one of the studies that changed the way we see the impact of air pollution in children. And now we go to the green. 60% of the population in Europe has insufficient access to green spaces, especially in cities where there's lack of space, so there's no green areas, and not as much as it should be. And 43,000 deaths could be prevented by year if we reach the World Health Organization recommendations. So why green is so important? Because not only acts as an ecosystem service, of course it cools the cities in the summer, so that's also a health impact. The runoff water goes into the soil, etc. But also it gives us the opportunity to do physical activity in green spaces. It's nicer, there's no noise, there's no traffic, because either you have roads or in the same place or you have a park. So that itself, it's better quality of the air. And then actually it reduces stress and social contacts. You can talk to people quietly, there's no noise. And then the restoration as well. When you go to a park, and we did studies on this, you can actually, you can think, your brain restores more after a stress moment. But who needs to do this? Designers, as we were saying, designers, architects, urban and transport planners have the chance to do all of this. They should be the ones that now taking the opportunity to change cities. And you know this, I'm sure, the concept of planetary health and global health and One Health. So basically, it's not just human health what we should take care of, it's the planet health, it's all the ecosystems, because in the end, everything is gonna affect us, and of course the environment. So we should really be concerned about the planet health as well. And the SDGs, the famous SDGs, they were designed to be a call for action, and protect the planet is one of the points here as well. And it's very explicit in SDG 3 and 11, where actually it says good health and well-being, it's number 3, and sustainable cities and communities. And urban transportation and planification plays an important role in the SDGs. And just briefly here, you have all the interconnections with the SDGs. I'm not going to go through them, but it's important because health is finally as a priority. And also we would need to put more money into, the system would need to put more money into prevention, because this is United States. It's only 3.5 in preventive services. It's very little of the money invested. And here, which you don't see, and I barely see it, it's just the countries in Europe that, and the amount of money they put for preventive care. So basically, health needs to be put in the center of all policies, because health is all what we have. If we don't have health, we don't exist. So it's a multi-sectoral approach, and basically, all the sectors in the society should have this as a priority, from the health sector, of course, to citizens, transportation, urban planning, architects, anything that comes up to our mind should have health as a priority. And this is where health in all policies comes up from the World Health Organization. Basically, what they did is an approach to integrate and articulate all the policy making to improve the communities, the health of all communities, of everybody. And this is just an example related to air pollution. Basically, air pollution needs to be tackled from different sectors, which is clean energy, housing, transport, again, industry, of course, waste management, and the authorities, and urban planning, which play a really important role in the cities. And then just some solutions to improve health in the cities. It's linked to what I was saying before. We need to change the land use, so have a variety of uses in the cities. Oh, sorry. Promote public and especially active transport. Reduce the use that we have of the cars, so change transport mode. And also make greener cities, make them much more green, because there was this trend a few years ago just to take all the trees and just do plazas with nothing. And now I think it's going back with the heat, especially with climate change coming in really hard. We need to get on with this. And then, of course, technical solutions, we need to incorporate them into the plan, because they can be really helpful. And activating the community resources. There's many people in the cities that want to improve. They don't work on it, but they actually are a big motor to impulse this. Barcelona Superblock model, I don't know if you know it. Barcelona is a grid, most of it, as you know, and basically it's a model that it's supposed to do like 600 super blocks within the city, and they basically work like this. So they did a unique platform. So they took out las aceras and just one platform, and pedestrians and cyclists have they are the ones that have the priority, and then cars can only circulate at 10%, 10 kilometers per hour. So this makes that people don't want to go in, because it's so slow, and you don't have the priority, so you have to wait until nobody is there. So basically what it does, it just exposes the cars outside naturally. I mean, if you live there, you can enter, everybody can enter, but you don't do it because it's slower. And then they did loads of greening in this. There's a bit of controversy here because prices went up a lot and everything, you know, it's difficult. It's not simple. Urban planning is not simple. And then these super blocks, if all of them were implemented, these 600, which will take a lot of years, would save lives every year. And this is the amount due to air pollution, noise, heat, and all the factors that we were mentioning earlier. And then the 330-300 rule is that everybody this is to have an equity for everybody. Everybody from home should have 3 trees, should be able to see 3 trees from home. 30% of the neighborhood should be covered in trees, and 300 meters distance to a park. And then the city of 15 minutes. I really like this, and it's 10 years. This concept is only 10 years old, and it's a city. It's a medium city where you can walk by walking or cycling. Everything is at 15 minutes away. So you don't take the car to go to school. You don't take the car to go to have dinner or to go to the cinema. Anything, and everything is in a radius of 15 minutes. This is the cities that we want, right? This is Barcelona. I don't know where this is actually. And then green cities, everything is for health. So green cities, healthy people. Active cities, healthy people. Clean cities and social cities will make healthy people. And then I really like this quote by Jan Gehl, which is an urbanist, an architect. He has a great book, Cities for People, which I didn't read yet, but it's great because I've seen bits of it. And he says that life happens on foot because when we walk and we share our life with friends, with family, this is life. Life doesn't happen when you drive. Driving is stressful. City and being in the city and enjoying the city, it's where we take the fresh air and we have time outdoors. So really this time is what matters. We have a catalog of resources at IS Global. They are open. They can be used. So feel free to enter and have a look. And muito obrigada.
It's very strange for us. I think I can speak for all of us when we see this. And it's like an imaginary world.
Yeah.
Because in our daily life, this is it's theory. It's very complicated, as you said, to put this in practice. It's very complex, very difficult. For these people who have to be leaders and to pick up the pieces of not healthy cities, in fact, what do you recommend from the base to the top and to do the pressure to the top to change everything, to give up the kickoff of the change? Because we are talking about health units and we talk about leaderships. And they have to pick up the pieces, like I said, of lacking all of this. So in your experience and in your advice, what should do, if we have to choose one priority, what could they do?
I would say maybe physical activity. It's well known that has a big impact, even for any ages. Maybe encourage people to do physical activity in less polluted places, and also ask the patients, I guess, right?
Yeah.
Ask the patients to ask for these places, because to the governments, because you can do that. You can ask for places, and it's a bit cut streets, cutting streets, giving the space back to the people. I lived in Barcelona. I don't live in a street that it's so busy. But at the weekend, they cut it from 9 to 9. At the beginning, people were like, no, we're going to sell less, all the stores, blah, blah, blah. But then it was so, people come from the outside just to walk around and it's so nice, loads of tables, people having a coffee or anything. And it's just nice. So, I mean, it's through people from the city that these changes happen, when people ask for it. So maybe asking people, now it's when you go to the doctor, there's screens, and they actually recommend, like go and have a stroll in the park, in quiet places, and all these things. So maybe, if people start doing it, they will want more. So I think maybe asking people to do it and telling them explicitly, it would be better if we had more, because then they are the ones that could...
like a prescription. We can...
It's a prescription, actually.
It's a prescription, it is.
Yeah,
it is.
It's starting, but yeah.
Yeah, and in terms of conjugating it all, I don't know if you know, but 1 year and a half, we started a wide reform that we have integrated the hospitals with the primary care.
Okay.
And that's okay. We are in the same, not in the same velocity from them all, but it's a big change. But do you think it's an opportunity, this kind of connection?
Yeah, because the primary care is so important. Is when you get, your patients, you get to talk to them and maybe giving some recommendations, like just walk as much as you can.
And other behaviors or
Absolutely.
other healthy
nutrition,
for instance.
Absolutely.
And it's a great opportunity because you have to create, if you can, because it's major, partnerships with different entities. I think you know that's a big deal, isn't it?
Yeah, it is. Because then because most of the time it's not that they want, for example, architects or urbanists, it's not that they don't want to do anything regarding to health. It's that they never thought about this. So it's just getting the idea and then, slowly penetrating into different sectors.
Even politics is the most important thing.
Well, now it's getting, even in the European Parliament, they are starting to talk about it too.
And we have to think like this. Everything is interconnected, isn't it? Everything's connected. So, Gloria, thank you so much.
Thank you.
Coming.
Muito obrigada.
Thank you.
Thank you.